My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to Kobecha. We are back again with an interesting topic on renal failure. That means kidneys that fail to do their function. We're going to be exploring various angles and how you can pick up the signs that tell you that something is not right with your kidneys. Please make sure you stay with us and enjoy the show.
Hi viewers, my name is Lorica. Welcome back on another exciting show. We have our topic today is all about kidneys. Welcome.
Before we dive into the discussions of today, I've prepared this clip for you. Please take a look.
This is a grossly misdiagnosed and underdiagnosed condition which causes a lot of health complications. It affects young and old. But because it's largely linked to high blood pressure complications, many times it is not detected at all until too late. While blood pressure has a part to play as both a cause and an effect, there are other serious causes which doctors and specialists fail hopelessly to detect. One such is MCardle's disease.
Welcome back. As you can see, kidneys are a very important part of your health. And as usual, we're going to be discussing around the questions, the normal questions that we get from you to try and answer them, and Lorica is going to be driving that. But in the second part of the show, we're going to be looking at a condition which is called MCardle's disease, which is very big on destroying kidneys without being detected early enough. So please make sure you stay with us until the end of the show.
Okay, thank you, Thembi. Is it possible to have kidneys totally failing without picking up signs?
Actually, theoretically, it shouldn't be the case. But the problem that makes people reach that unfortunate situation is because they do not read the signs correctly. Because it's one thing to receive signs, it's another thing to be able to interpret them correctly, know where that's leading to. And I would largely blame the doctors in that case, because when you pick up signs of a certain condition, a certain symptom that is persisting, you go to the doctor when you realize that your over-the-counter medication is not helping you. You go to your doctor. But when your doctor does not pick up that the problem is actually linked to your kidneys, then it takes us to your question, is it possible? And I pick up, it's common. I've actually found quite a few people that are sitting with that kind of problem, and yet the kidneys are seriously in trouble. I can just, at the top of my head, I'm thinking of one particular lady who I saw in Joburg, who did not realize that the kidneys were involved. Of course, they were not failing. Well, they had not packed up. They had not packed up, but they were in, she was in trouble. But the thing that she was aware of, which also her doctor was aware of, was the recurring inflammation of the body. Yeah, that she was consistently on antibiotics, different types of antibiotics. She would be fine, but then she would develop inflammation again, but not necessarily like respiratory, but just generalized kind of inflammation continuously, So when she came to me, she came because this was the problem, and she was on treatment for that, but recurring. So, and it was the kidneys, it was the kidneys. Now, because remember, the kidneys, they are purifiers. They purify the body of all the impurities. So now when you're sitting with all that inflammation, because inflammation is indicative of pathogens, an influx of pathogens or infection or a combination. So you can't keep on, and only look at one section or at other systems without looking at the kidneys. So she was having that, and it was kidneys. I remember when I gave her the results, I said, you know what, I would actually advise you to go for a dialysis. But now, dialysis, because it gives an alarm to people. I mean, people get such a fright when you say they must go for a dialysis. The reason why I was saying I would recommend, not because the kidneys had packed up, but because they were struggling so much to purify the blood. Because that's their function, blood purification. And dialysis is blood purification. So when I was advising that she must talk to her doctor so that they would put her on a short-term, temporary dialysis just to assist her system to purify that blood. She opened the eyes like this, but I don't know if she ever went because she said I must give her the treatment, which I did. And she responded very well in the treatment because it's not like I could not treat her. I would not be able to treat her, but some of the techniques that conventionally uses, they quick fix. Like when you go for blood purification through dialysis, you go in, they put on these machines, they clean, then, they put your blood back into, because it's a circulatory kind of. Whereas with me, you're going to have to pop up this, take this supplement, you take this tab. Maybe it's going to take you a week, a couple of days to realize maybe the same result of purification by the blood. It's just like things like maybe a headache. You find a person has got a headache, it's caused by whatever. So the headache pill takes away the headache now. Whereas with me, maybe by tomorrow, you're going to feel the difference because our systems or our techniques, they follow the body's, navigation system. So it's possible, not just possible, it happens. It happens, and it's not that uncommon. From where I'm sitting, I've seen a few people that have got serious, and people I would tell you are on stage 4, renal failure. The person is not even aware that she has got kidney problems. I remember one lady who told me, one patient, and she had MCardles. She said the interesting part is that she never knew that there were kidney problems, and she was never told because she was in and out of doctors' rooms, but for a problem of the knee, the knee and the body stiffness and all that. So, but this particular day, they wanted to do some other tests. I don't know what kind of test that they did in this particular instance. And then she was told she must go for dialysis. And when she came to me, she was already not on a temporary dialysis, but on a permanent, because the kidneys had really, suffered extensively and they could not be reversed. So what I'm getting at is, it is a dangerous path that people are walking on without realizing that so much serious stuff is happening. But where do you go when you've been to your doctor, you go to your clinic, they give you whatever, and then you keep coming, they refer you to your doctor, or you've got a private doctor or medical aid. But you do go, but they don't pick up that there's a serious renal failure up until the kidneys pack up, until they pick up electrolytes that are totally out of balance, or you're retaining fluids, because they look at those, So that's a problem that people are dealing with. Yeah.
Thank you very much. Uncontrolled blood pressure is the number one culprit causing renal failure. Is this a fair assumption?
Number one, well, I don't know if it's the number one, but it rates very high. Okay. It really rates very high because almost every Tom, Dick, and Harry is suffering from high blood pressure. And high blood pressure, when it's not controlled, it really messes up the kidneys. But there is something that I've found to be a misunderstanding, or I don't know what to call it, on the side of doctors. High blood pressure does lead to renal failure when it's uncontrolled. It really lambasts the kidneys. But kidneys lead to high. It's actually a catch-22. This causes this and this causes that. But you find that the tendency is that it's only looked at from one angle only, that when you've got high blood pressure, your kidneys are in trouble, without realizing that the reason why you're even having high blood pressure in the first place, it's because of the kidneys. Okay, so they're looking at it incorrectly. Okay, and this is what happens also in the case of types of high blood pressure, because people don't seem, most of the people I've found, they get shocked when I tell them, no, your type of blood pressure is because of the liver, portal vein hypertension, or you've got pulmonary hypertension. So it doesn't mean when you've got high blood pressure, it always is because of kidneys, or it's always linked to kidneys. The kidneys may be totally clean. Like, for instance, I remember I had a nurse who stayed in Kwamakagi, who told me that she took an early retirement because of uncontrollable blood pressure. She said it was a voluntary resignation because she feared, she wanted to focus on her kidneys, on this blood pressure, because she couldn't stand going for dialysis. Because, she's a nurse, she's seen what happens when you reach that stage. So she took an early retirement so she could attend to her high blood pressure. Because she said in the morning, because she was working, I don't know which section, but she was working with doctors. I think it's a pre-admission or whatever, I don't know. But she said, every morning when I get to work, I would test my blood pressure so that I could ask these doctors to. And she said it was always so high. So now her fear was the kidneys. So when she came to me, she was convinced that her kidneys are really messed up. So the reason why these doctors were not picking up that there was some serious issues was because they did not know how to test. So she was coming to me with the conviction that I would be able to test and see that her kidneys were really, really bad. There was no way she would have this uncontrollable blood pressure and her kidneys would not be badly affected at that stage. And they were right. The doctors were right. Those kidneys were not affected as she expected them to be, because her type of blood pressure was portal vein. It was linked to the liver, So when I told her that, she was like, I could have, blown her with a feather, And we treated her, and we treated her because it was also one of those fructose intolerant issues where you find the liver is really packing up because it's bashed by aldosterone speed deficiency. So I treated and her blood pressure normalized. She didn't even need to take medication to control blood pressure ever again because that portal vein that was exerting pressure, we had sorted that problem. So this is what happens all the time with high blood pressure, that it's so abused, if I may put it that way, used as a culprit in every situation. Meanwhile, the type of blood pressure that really messes up the kidneys is adrenal hypertension. Because adrenal hypertension, when your adrenal glands are failing to produce aldosterone, which helps to manage blood pressure by naturally. So when there's something that's affecting your adrenal glands, and therefore they're failing to produce the hormone that's managing the blood pressure, then you're going to have issues. But now once you've got problems with your adrenal glands, remember adrenal glands are part of kidney structure. So the problem will originate from your adrenal glands and they end up affecting your kidneys. Okay, so it's not because the kidneys have led to the adrenal glands, it's the adrenal glands that have otherwise caused problem for the kidneys, and therefore the rest is history. But also the same would also happen, that when you've got problems with your kidneys, whatever's causing problems with the kidneys, it will affect your adrenal glands, and then you might have issues with blood pressure. So what I'm saying is, to conventional practitioners, is you don't just look at kidneys as being the victim to blood pressure. You must know kidneys can also be the culprit in causing high blood pressure. From the onset of high blood pressure may be solely because of issues with your kidneys, whatever's causing problems with your kidneys. Like we are going to look at MCardle's, for instance, and see how that nails the kidneys, and then the kidneys will eventually nail, your hormonal balances, and then cause you to have issues with kidneys.
All right, thank you. What are the common signs that people should look out for in renal failure?
You see, the kidneys, when we talk renal failure has got stages, which are already determined by conventional medicine. Renal failure is when you reach, say, stage 4, stage 5, particularly stage 5, when the kidneys are actually totally packing up. But the damage starts at stage 1. So, but people, you find they are not, of course, at stage 1, it's still where you can fix. Even stage 2, stage 3, you can still manage. Stage 4, stage 5, that's a problem. Especially stage 5, they've packed up. They say, we cannot do nothing. So the telltales are not indicative that you have renal failure. Renal failure is when your kidneys are failing totally to do their function, so they cannot excrete the toxins, from the liquid, from the urine. They cannot make hormones. There's a whole lot of other functions. They cannot balance your electrolytes. It's a number of things that the kidneys are doing other than just eliminating urine. So people must understand that. But to get to that stage, it's a progressive, a process where you find, maybe for instance, you might find with urination, okay, that you find you tend to have a recurring urinary tract infection. Your urine tends to burn, okay. And it's infection, you take the UTI, drink antacids, drink this, drink that, it's fine. Then you find it keeps coming. That's the UTI, okay. Most people tend to have that as a common sign that something is not right with your renal system. It may not be your kidneys, it may even be your bladder, okay. or even your ureter, because I saw one person the other day. Remember, the ureter is those tubes that lead urine to your bladder from your kidneys. So the one ureter was so blocked, that it was causing the retention, the urine retention. So I asked her, she said, no, I don't urinate. I mean, me, I watch people drinking a lot and all. Me, I don't go that often. Even when I pee, then I find I will feel as though the bladder is full. But when I pee, it's like drops. It comes in drips and drabs. It's not like, So that, I mean, she had serious issues of one kidney, actually, not both kidneys. So what I'm saying there, for urine retention, urinary tract infection, that's a sign. It doesn't mean when you've got it, that's always the renal problem, okay, or kidney problem. But it is in the list of fear. And then also the urine, the urgency, where you find a person says, I cannot hold the urine, the urine incontinence. When they've got urine, such that you find some end up using sanitary pads because they just cannot hold the urine. They just urinate. So that incontinence, that's a sign. Of course, the person already knows something is not right. It doesn't mean it's always only the kidneys, but the kidneys are part of that. And the retention, so it's urinary tract infection, it's urgency or urinary incontinence where you cannot control, or it's the retention, like I'm saying, that you fill up, you feel full, but you pee, it comes in drips and drabs. Or the interesting one that people don't believe when I tell them is the ear infection. Once you've got a persistent ear infection, of course there are other things that will cause those issues, but particularly when it comes to children. Children, once they've got persistent ear infection, it's got pus, it's not coming right. The kidney, you must ask your doctor to look at the kidney, because they share certain physiological fluids, certain proteins. So they are connected, as you can even see the shape, that they look the same. If you look at the kidney and look at the ear, they are, they look the same. So if you've got a persistent ear ache or ear infection, but something that's bothering your ears, and it's not responding to anything, or eardrops or whatever, ask them to take a look at your kidneys. Also, if you experience pain on your lower back, or sometimes not even on your lower back, coming to the front, the flank, coming to the sides, you feel, they say, it's menstruation, it's menstrual pain. Of course, they would also cause that, your ovaries, because the location is almost the same. But if you've got a persistent pain, or when you find if you've been sitting for too long, then you find it's when you get up, it's that may also very well be the thing. The memory. The memory. People don't believe that the kidneys, they mess up your memory. The memory. I've shared this in the show once. This parliamentarian, she said, I was the chairperson of this house of whatever, can't remember. And she says, Thembi, you're the one that's supposed to remember, because you're coordinating the discussion. So everything that is said, you must be able to connect. What if this some person is saying this? You must be able to make a reference from the person, because you're the one that's chairing. She said, it was an embarrassment. And no matter how hard, because she said, even if you're writing, you're making some notes, those notes, if you can't remember what you have written up, and this person is asking, how fast are you going to know? Because everything that said you read. So how are you going to even know how to take that particular question and link to which part of the notes? She said it was a disaster. Total disaster, and such an embarrassing situation. And it was the kidneys. So she couldn't believe when I said, kidneys, because I saw. So what I'm saying, memory, people may not believe this. Memory is a big, big sign of renal issues, kidney issues. Also the irritability, once you get so irritable, and that's also a telltale sign. Also, just getting tired, not because you were working or you were doing anything, but you just feel, So there are so many things that will give you signs, but once they persist, because it doesn't mean when all of a sudden. So once they persist, you look at all and you eliminate all the means of dealing with the situation, and then you find it's still persisting. And if you have not looked at the kidneys, then look at the kidneys. But now, those are just the initial signs. Once it gets serious, you'll find that it's just like when you comrades marathon, you find everybody's there, we're all running. But now as the steep becomes, then you find it's the ones that are managing to. So that's what happens even with so if you see certain symptoms that you find of this whole lot that I'm mentioning and others, of course, but you find there are those that tend to come out and stand out. Then you fall and you followed all other things. Tell your doctor, can you please test me for kidneys? You must not be shy to ask that, because that's the problem, that people will say, I did ask my doctor and he said, no, it's not possible that it could be this. I remember this person it was the spleen. I was telling her that she's got an enlarged spleen and an enlarged liver, splenohepatomegaly. And I laughed so much. She said, no, he wanted to book her to a psychologist. Ask if, did you not have anything that hurt you or not? She said, yeah, my boyfriend, I broke. She said, yeah, that's what I'm going to. So he was going to book her to go to a psychologist because she said that pain, because the pain was persisting. So when I told her about the spleen, that the spleen was, she said, I Googled it because the symptoms of this, and there was a part that, because Google will give you a whole lot of things. But now she said there was one that when I looked more at the spleen, and it fit. And then I asked this doctor, could it? I said, no, it's not. No, it can't be the spleen. And I said, So what I'm saying is, you must ask your doctor to refer you to a kidney test, a further test, more advanced test, and not just accept when he says, no, it's just whatever. Anyway, let's go for a break. When we come back, we are going to look at MCardles.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to Arries enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat.
Welcome back. We are talking about kidney problems, what is called kidney failure actually. But we just taking it from the onset, how you can actually detect and follow so that you save yourself from reaching that stage. So I was mapping out those few telltale signs. But as I've said, we are now going to look at MCardles, because MCardles is a very serious condition that is not a kidney problem, It is a sugar storage problem, but it destroys the kidneys totally, particularly that it is not easy to detect it. Just to give a little bit for people to understand what MCardle really is. You see, the body has got a musculoskeletal system, which is the limbs, this area, your limbs, both your limbs, your heart, your lower limbs, the system that you use in activity, whether you are jogging or you're working or you're doing whatever kind of activity. So that is the system that I'm talking about. But now that system has got its own storage system. It stores sugar in the glycogen format, okay? And you will use it when you need to use it. Once the blood says, I'm running short of fuel, I need more sugar, and I need it for this region, then your glycogen gets converted into glucose because the body does not use it as glycogen. It only uses sugar as glucose. So, but it stores it as glycogen and it uses it as glucose. So now, for that glycogen to be converted into glucose, there is an enzyme that we are born with, which converts that glycogen into glucose. So when you are born without that enzyme, then you've got MCardle disease. And when you are born with that enzyme, you are actually in trouble. In trouble because you will always have tissues, your muscular tissues being exposed to being damaged to scary levels, to seriously scary levels. Just last week, I had a 33-year-old who came to see me because she was diagnosed as having a serious rheumatoid arthritis. Yeah. She was diagnosed with arthritis. And it was so bad such that her doctor actually recommended that she must be permanently boarded. And she was not even aware. She only saw it when, I don't know who managed to see it, that no, they are permanently boarded. Because he was looking at her. This is a 33-year-old. So when she came to me, even the way she walks, she was in pain. And this is the type of pain that she experiences throughout. She does not really get a relief. It's worse in winter. And the way she was walking, she was walking like this because she cannot walk, she cannot flex, you know. So she was walking like this, and in pain even when she sits, and she was diagnosed as having serious form of arthritis, and it was MCardle. But now, why is there such confusion between arthritis and MCardle? Because, like I've said, these are musculoskeletal muscles. Like these muscles are enveloping your bones. But you use your muscles, you use your bones. They work together in your cardio, in your activity. But the damage is not in the bones, is actually in these muscles. Because that's where the glycogen is stored, okay? And when you need that glycogen for it to be released and you don't have the enzyme, it does get released with activity because the brain sends the signal. We need sugar because you are active. So now, but that sugar is not converted into glucose, but it gets released. Doesn't mean when you don't have this enzyme and the message reaches your muscles that we need sugar, it does not get released. The muscles do their part. They will release glycogen. But then glycogen is not converted So it is toxic. So it actually accumulates in those muscles. And that's why you find, for instance, she was so stiff because she was the worst type of MCardles. I mean, I do treat people with MCardles. You find it will maybe hit the knee. It hits around the joints especially. And that's why it's so difficult to detect it that well, because it's looked at as arthritis, because it's around the joint. When you move you flex your knee, you feel the problem. You won't be able to tell that it is at a muscular level, not at the skeletal level, because they are all together like that. So, but with her, it was the whole body. So that is what happens there. For that glycogen, it will finish those muscles because it's poison now. And now remember, this is not something that's going to happen once, because with every activity, you need that glycogen. So you need that glucose. So constantly, the more you're working, the body needing that, you're just going to be exposed to that agony right through. So that is a very difficult kind of a condition to be subjected to. It really is a big one. But it doesn't just end there. If at least it was just messing up the muscles, we'd say, okay, we deal with that. It messes up the heart, because the heart is a muscle that works in your cardio with your activity. But then it brings in the kidneys. Where do kidneys come in? Because when all that glycogen that is not converted is released, it must be eliminated. Your elimination system will try to get rid of it. It's in the tissues. You are getting rid of it. But then where does it eventually go? To your kidneys, because the output, the end part of your liquid output is your kidneys. So it gets to your kidneys. I get shame. It finishes those kidneys. But now the problem is, like for instance with this girl that I say she was coming for arthritis. And she is the one where the ureter on the one side was so obstructed, she was retaining so much urine, and one kidney was almost finished already at stage 4. And she didn't know it's the kidney. She feels this pain. She knows when that she drinks water, she watches people drinking water, running to the loo. She says, no, me, I don't even care to drink water, But when I've drunk water, I don't really go, I go, but not like according to the quantities that I take in. Because that kidney is like, but fortunately the one side was still fine. So it was doing the work of the other. So, but what I'm saying therefore is, MCardles finishes the kidneys, but it is not a kidney original problem. It is a muscle original problem. It's a glycogen, a sugar storage problem that finishes the muscles, but the end result is your kidneys. And it will finish those kidneys. Your urologist is going to look all over, but I've seen how they battle to detect MCardles. Besides this patient that I'm talking about, but there is one interesting one that I would like to present to the viewers, because I took some steps to help the doctors to detect it, because I realized that there is a need for intervention from alternative. From me in this particular case. But please take a look at what I text to her doctor. Now, if you look at this text, this is a personal text that I sent to, I've blocked the name of the doctor. This is a public hospital. And this lady went because of a knee pain. The pain was around, she was even using crutches because the pain was excruciating. So she went to hospital because she admitted herself in hospital because she just could not sleep nonstop. And they were doing all the tests and they could not give her treatment except for pain. Then they ended up giving her medication to sleep because she was struggling to sleep as well. But she ended up refusing to take the sleeping medication because it makes her dizzy. But the long and the short of it is there was not even a small indication of them looking at the kidneys. They were just focusing on the knee. So it is at that stage that I felt, let me help not only to save her kidney, but to save her from the pain. Because up until they know what they're treating, they're not treating except managing the pain. So I wrote that to the doctor, hoping, as you can see, I indicated that if you want to talk, there's my number. I put my number. And now the junior doctors were the doctors that were treating her, but then there was the senior one who they were reporting to. So he didn't call me, but the letter shook them, okay? Because they had already, in fact, when I gave them the letter, it was simultaneous with them receiving a report from the radiologist or pathologist. I don't know who did the test because they were running a huge list of tests. So the one that came had said she has got giant cell tumor. So that was the diagnosis. So now at least they were relieved because they had detected what was wrong and they were going to operate to remove the tumor. But they could not be able, they were not qualified enough to do the procedure themselves. So they were going to work hand in hand with the hospital, with Grooteskier, I think, in Cape Town. Then I come with my letter. So I came with my letter after all this had been decided. So I come with my letter. My letter, as you can see, I'm telling them what this person is suffering from. They are sitting with a giant cell tumor, and I'm saying she's got MCardle's, and it is the glycogen dumping that's actually destroying the muscles. It's not a bone problem, it's a muscular problem. But at least we were talking the same thing in terms of muscles because they also identified that it was the ligament that was seriously affected. So the muscle, they also agreed it was not a bone, it was a muscle, it was the ligament, but she had a giant cell. But now after I gave the letter, the principal doctor came the following day. He came and he said to her, this is giant cell. He came to emphasize their diagnosis. And then I had said to her, she must ask them about the kidney. Because if you look at my text, I say the kidney on the right side is on stage 2 renal failure. And also the heart muscle is exposed. So she said, and she did experience the pain. So when she asked them, what is then causing me to have this pain? They said it is because of the inflammation from the knee. So, but they never did anything. And then I asked her, did they do the kidney test? She said, no, not now. They had done the kidneys when they were going to do that biopsy or whatever test they were going to do to end up coming up with giant cell tumor results. They had done the urine test. And he said, that this is now the principal, he said, no, there's nothing wrong with your kidneys. Your kidneys are perfect. When she asked what could be the cause of the pain. So I could see that also she was not certain because, I mean, remember, when you seek, you don't want to know that this is you want something that's going to be maybe a bit light or whatever, I don't know. So then I said to her, well, I told her that if they had done the test other than just urine test, because this is the other problem, that when they do urine test is just very preliminary. It will maybe test if there's no blood, if there's maybe albumin in your or protein. They check those, and if all those things are nil, then they will not do other tests, because that's the entry point of determining whether to continue with the test. And you won't pick up GFR rate from urine test. The kidney failure at stage 2, think you will be able to pick it up from testing the urine. So that's what I told him. But anyway, the good thing that came out of that was that they ended up deciding, they're not going to do the op. That op that they were going to do, working hand in hand with Cape Town, they decided they must send her to Cape Town rather than do the op themselves. And at Cape Town, they also did their tests and all that. But the one thing that she told me then was that Cape Town detected it is not giant cell tumor. So the thing that I had told them, Cape Town confirmed it is not giant cell tumor. But whether it was MCardle's or whether they detected MCardle's or they test MCardle's, she doesn't know, because they never said anything about that. And the other thing that you must understand with how conventional does their test, they depart from the symptom. So what's going to make them go to look for MCardle's? Because this is the problem. This is where they are focusing on. So in a nutshell, I was giving that scenario so that people can understand that it is not a joke to detect this condition. So, and if you've got MCardle's, you are at a risk of kidney failure, and you may not even be able to detect it until your kidneys have packed up.
How come a condition that is so serious that doctors fail so badly to detect it?
Yeah, but that's largely because the departure point of conventional medicine is the symptom. And like I've said, that MCardle's is not a kidney problem. It destroys the kidneys, but it is a sugar storage problem. So if, for instance, it was a problem because remember, conventional medicine has dissected the systems so much that for you to be able to be detected to be having kidneys, you must go to a urologist. And that urologist must be informed by the GP because of ABC. So if they test your urine and they don't see anything, they're not going to do anything about the kidneys. Even worse if you have to be taken to a urologist. So you should be reaching a certain level of kidney symptoms that they will refer you to a urologist. And MCardle's is not a urologist condition. It is a condition that belongs to pathologists that deal with muscles or even your neuro function, And because if you've got problems there, your muscles, you've got pain, they're going to call your neuro, because it's, why are you having so much pain? It's not coming down. So then maybe at the muscles, because it's a muscle, or even at your orthopedic, because in her case, she was at the orthopedic section, because it's the knee that's got a procedure. She was not at the orthopedic section, because they're convinced it's the knee, it's a bone. So now you're sitting at the bone. Meanwhile, there's the damage that's so serious, that's finishing the kidneys. And It's your muscle. So that is the problem, that you will sit, you are at the risk of renal failure, total renal failure, and they are busy looking at that knee. So that's the problem that faces conventional, because their departure point is the symptom. I'm not saying that should not be the departure point, because that's how they've been trained. Because, I mean, if you cannot depart from where the symptom is coming, where else are you going to depart from? Because the reason why this person is coming to see you as a doctor is because she's got a problem with the knee that's paining. So you're going to look there. So the way their training has been set up is actually setting them up for failure in detecting so many complicated conditions. You know, it's really setting them up for failure. So that's the problem. And I have all these people that I'm dealing with who have got MCardles. Not one has been detected to be having a problem of MCardles. You know, some are having, one is actually having a serious problem of a kidney failure. He's already on dialysis. But every other one that I'm dealing with, it's the knee. Like this recent one that I'm talking with, they say it's rheumatism, you know, rheumatoid. So that's where they're focusing on. So they give you this, it's not working. They give you that, it's not working. They keep giving you something that's around, and then they end up not giving you anything except pain management, because they don't know, what do we give you? Where do we move from here? So my concern is, I don't know seriously how to get through to them. So that, because look at this case, I was not going to take that patient away from them. She's in hospital, but at least I'm giving them where to look. This is going to help the patient, this is going to make their work easy, but it's bruising their egos. So because now they're protecting their egos, how can I make them look like they don't know? I mean, these remember, this is the principal doctor who is now on top of this case. He's got his juniors. Now here are the juniors, and they see, oh, Dr. So-and-so, the Nkalagata, but he doesn't know, you know. So they are exposing people to so much unnecessary suffering because they are nursing their egos. They are nursing their egos. So I don't know, because I'm not sitting and not doing anything. I'm still paddling to make sure that eventually at some point we will work together. And I've accepted that it looks like this should be my task. That's where God has placed me. It's my task to keep on paddling until they can listen, you know. But up until now, it's still looking very bleak at the moment that they will listen. But it is the circumstances that are actually going to force them to look. So anyway, this is a touchy one. So if you have got a persistent muscular problem, or it's the rheumatoid diagnosis that you're sitting with, that you've got arthritis, you've got the worst form of arthritis, you're not responding to anything, this and that, you must please come to me so that I can test if you're not having tissue damage because of glycogen dumping that's occurring in that particular area. Otherwise, your kidneys are so exposed, your heart is so exposed, you just cannot believe how much.
But before we finish, Thembi, I would like you to just answer this question. What should people look out for?
Well, in the case of MCardles, like I've said, if you've got problems that have, the kidneys may actually be the very last one. You've got a knee that's bothering you, or the leg, It's persistent. The pain is excruciating. You think it's the rheumatoid, or maybe you feel stiff. Particularly those people who say, I feel so stiff, as if, you take all the magnesiums to try and loosen, but you still feel very stiff. Those are the telltales of MCardles, because of that glycogen that's actually sitting and is not being released because it's not converted. So then it's stuck in those muscles. Then you feel a serious stiffness. You find if you've been sitting, it gets worse. So you find when you walk, you end up having to walk like, So that is the big one that will indicate it's MCardles. And remember, we're not looking at the kidneys, we look at the muscles, but they lead us to your kidneys. All right, so that's where we're going to end our show today. Thank you for watching, and goodbye.
Thank you, viewers, for listening.